Today, we have identified 49 new cases of COVID-19 in Alberta in the last 24 hours. This brings the total number of cases to 1,500. Of these, 713 people have recovered. This is 121 more than yesterday. We suspect 201 of our total cases may be as a result of community transmission. We have completed 2,123 COVID tests in the last 24 hours. This number does not fully reflect the thousands of Albertans who have had testing scheduled after completing the online assessment tool, as it takes time for this increased volume of requests to make its way through the system. As of last night, I was told that more than 6,000 people had been referred for testing in the previous 24 hours, so I expect the number of tests processed at the lab to rise in the days to come. Sadly, I must report an additional 7 deaths from COVID-19. This is the highest number of deaths we've seen in a single day. This includes 4 new deaths at the McKenzie Towne continuing care facility. There have now been 17 deaths at this facility. To the family and friends of these 7 people, and to all who have recently lost loved ones to any cause, I extend my deep condolences. I know that many people are concerned about the health of residents at continuing care facilities, and I am as well. We are exploring every option to prevent illness and deaths and to keep people in continuing care facilities safe and healthy. This includes examining what other jurisdictions are doing to see where Alberta can do more. Today, in line with this analysis, we are taking new steps to prevent the spread of illness in continuing care facilities. All workers in these sites will be required to wear masks at all times when providing direct patient care or working in patient care areas within 2 meters of others. We are making this change to protect patients from inadvertent exposure from a healthcare worker who could be without symptoms but still be infectious. Continuous masking will also minimize the risk of an asymptomatic or pre-symptomatic healthcare worker exposing other workers to this illness. In addition to new masking requirements, we are requiring all workers in continuing care facilities to work at only one site. This will help prevent the spread of illness between facilities. These requirements are currently in effect at outbreak locations, but will now be required in all long-term care and supportive living sites across the province. Work is underway with the organizations that provide care in these settings to transition to this requirement, which will be implemented beginning late next week. Lodges with no supportive living designation and group home providers are encouraged to participate in this process of assigning staff to work at only one site, although at this time, for these providers, it is voluntary. We will work closely with providers of care for those living in all settings, from long-term care to group homes, to ensure that residents of these facilities continue to receive the care they need and to mitigate concerns about the supply of staff at each site. While these steps are necessary to prevent the spread of infection to and among elderly people who are at high risk of severe outcomes from this illness, they are not easy. I know many Albertans are finding new ways to connect with their loved ones in continuing care facilities, and I am encouraged to hear your stories. From making signs to hold up outside a family member's window, to virtual visits using a tablet, and especially simply picking up the phone. Thank you for doing your best to make this difficult time a little easier for some of the most vulnerable members of our communities. These efforts will be even more important over the long weekend and in the coming weeks as we work hard to keep long-term care and continuing care facility residents safe and healthy. In addition to these changes, and effective immediately, Alberta Health Services is implementing a policy for all healthcare workers providing direct patient care or working in patient care areas in both AHS, contracted provider and community settings to wear a surgical or procedural mask continuously at all times and in all areas of the workplace where social distancing is not possible. This applies if they are either involved in direct patient contact or cannot maintain adequate social distancing from patients or co-workers. AHS is making this change to protect patients from inadvertent exposure from a healthcare worker who could be without symptoms but still infectious. Healthcare workers who do not work in patient care areas or have direct patient contact are only required to mask if social distancing cannot be maintained in the workplace or if entry into patient care areas is required. We continue to remind all healthcare workers that appropriate and judicious use of all personal protective equipment, including surgical or procedural masks, is necessary to conserve supplies and ensure availability through this COVID pandemic. Adherence to the guidelines that have been put out by Alberta Health Services to their staff and the guidance that we will be publishing tomorrow for all continuing care facilities is critical. On a different note, I know Albertans may be fielding questions from the young people in their lives right now. Kids are facing a lot of changes and uncertainty, including doing school online, staying away from playgrounds, and not being able to visit with their friends in person. Today, there is a new fact sheet online at alberta.ca/COVID-19 made specifically for kids and their families. I encourage you to take a look and use the information to have open, honest conversations with kids about coronavirus and the measures we are taking to prevent this spread. I know isolation, physical distancing, and other public health measures may feel particularly difficult over the holiday weekend, and as spring finally makes its way to Alberta. But please continue to take all necessary steps to prevent the spread, follow all public health orders, and reach out to your loved ones struggling with loneliness or isolation. These steps are more important than ever. Thank you for participating in keeping all Albertans safe. Enjoy the rest of your long weekend,